Hi, Lisa Anderson here from a Healing Place Complete Counseling Care in Neenah, Wisconsin. So today I'm going to talk about the other two mental health disorders that are prevalent disorders in the United States, which is bipolar disorder and hoarding disorder. On Wednesday, I talked about anxiety disorder and depression disorder. And so I just want to make sure that we continue to talk about these different mental health disorders since this is Mental Health Awareness Month. Next week, I'm going to talk more about some children's disorders and the symptoms and treatment of that. So let's start with bipolar disorder because there's a lot of myths or misunderstandings about bipolar disorder, and I have a lot of clients who believe they have bipolar disorder because they might be moody or because their moods shift quickly, and that's not exactly what bipolar disorder is. I mean, there can be a piece of that, but that's not all it is. So bipolar disorder actually affects 2.8% of adults yearly and can actually affect up to 4.4% of adults throughout some time in their lifetime. And the average onset for a person with bipolar disorder is age 25, meaning around that age is when we tend to see the symptoms of this. So the problem that people don't understand is in order to get diagnosed with bipolar disorder, you need to have at least one manic mania type of event, meaning that you are having such a high. So there's real highs and there's real lows with bipolar disorder, at least bipolar disorder 1, and I'll talk about the other bipolar disorders here in a second. But you're looking for that, and that it's really going to be, that mood is going to become elevated. You're going to feel really good. You're going to start maybe getting grandiose, talking faster, trying to do things that you wouldn't normally do, not sleeping as much, trying big projects, and for a little bit you might be functioning quite well, but the problem is this continues, it's going to continue to get more elevated where you may start becoming delusional or hallucinating, becoming more and more irritable. And that irritability isn't I snap and I'm irritable, it's consistent irritability at all times. And so that mania will continue to grow. And that depression on bipolar disorder 1 in particular is very low. You can't get out of bed, you're not able to take care of your hygiene, you are not able to function, you can't concentrate. In both the manias and the depression, you will also see suicidal thinking occurring, more so in the depression side, but you can see it on the mania side also, which is one of the significant risks with bipolar disorder. So in bipolar disorder 1, there are 4 different types of bipolar disorder. Bipolar disorder 1 is what I just described, that really high highs and low lows. There's also bipolar disorder 2, where this is more, you have more of a mild depression and more of a hypomania, meaning you're manic, but it's definitely not to the level that it's impacting your activity daily living, that you're able to function, that you're doing okay, but there's this level of mood that goes up and this lower level of down. But again, it's something that is going on consistently. It's not like if I'm flipping moods quickly. If you're manic or hypomanic, you're hypomanic for a few days, or if you're depressed for a few days or for 2 weeks. Now you can go in points of time where there's normal mood with bipolar disorder, so it's not that you're always down or low. There certainly is normal type of mood, so I don't want people thinking that you're shifting constantly, because that's not true either. And then there's also what they call cyclothymic disorder, which is I struggle a little bit again with that hypomania and that mild depression, but this has been going on for more than 2 years. So it's not just I've had this for a couple months. And again, certainly they can have times like 8 to 10 weeks where there's no issues whatsoever, but there's this longevity of this hypomania and mild depression. And then there's bipolar disorder called other specified, meaning that you're not quite meeting the criteria for any of the bipolar 1 or 2, but certainly you have that depression and that mania level to some extent that they can't really classify you in any one of those, but it does demonstrate that you have bipolar disorder. So again, I have a lot of clients who will think that they have bipolar disorder. It's even though there is this 2.8% of the population, it's not that typical of a disorder. It's much more likely to be a major depressive disorder, which can also come with anger and irritability, or a general anxiety disorder, which also can come with anger and irritability, or trauma, which can also come with anger and irritability. So you really are looking more for that manic. In fact, to get diagnosed with bipolar disorder 1 in particular, you have to have had a mania event in order to even get diagnosed with it. So that's a criteria for that. Now let's talk a little bit about hoarding disorder. Hoarding disorder is actually one of the more prevalent mental health disorders out there. It's just a lot of people don't know that. So 2 to 6% of the population are going to be diagnosed with hoarding disorder or have hoarding disorder. And so it's about 1 in 20 to 1 in 50, depending on where you're looking at that number. It does affect women and men equally. This is not one that one hits more than the other. The average age where you're really going to see it get to its worst is around age 55. There can be signs of it in childhood and certainly in the 20s, but at that point it's not impacting daily living. It's more when they hit the older ages that it starts impacting that. And hoarding disorder, there's two things that have to be there in order to be diagnosed with hoarding disorder. First one is that I acquire in large amounts and unnecessary amounts. And the second part is discarding. I can't discard. So these are people who oftentimes maybe shop for, are shopping every day, and they might already have a vacuum, but they buy another vacuum. Or they may see something that they like that's pretty and they buy it, even though they have 15 of those already. So you'll see that type of behavior. Or these are people who maybe at one point in time were collectors, but the collecting started getting out of control because of different factors in their life, and now it's overtaken their life. You're also looking to see how much of their living space is being used up by their hoarding disorder. So meaning, can they sit on a couch? Can they lay in a bed? Can they get to their kitchen? Can they use their home in the way it's supposed to be used? That's a factor of what to help and determine if it's a mild, medium, or severe level of hoarding disorder. The other thing about hoarding disorder is it tends to have comorbidity to it, meaning that they tend to have some type of other disorder, be major depressive disorder, general anxiety disorder. Trauma and hoarding disorder oftentimes go hand in hand, especially childhood trauma, so you'll see that happen. But there's a lot of reasons that hoarding disorder starts. And so for both of these, I'm going to talk a little bit about the treatment. With bipolar disorder, you really are looking, medication is a must for bipolar disorder because you need to get the chemical imbalance balanced. But the other part of this is definitely therapy. Research shows continuously, and this is true across the board for all mental health disorders, medication and cognitive behavioral therapy together are the two best things you can do for any type of disorder. It helps you stay more managing your symptoms. Think of it like someone who has diabetes. The pancreas is not performing correctly. It's not performing the level of insulin, so people are developing diabetes. They get put on a medication, and then they also have a nutritionist or a doctor that works with them to keep them on task to help them to manage their food and manage their mood and all of those things. The thing about bipolar disorder is it doesn't just affect mood. This is something that also can physically affect people. They can have diabetes, there can be heart disease, there can, unfortunately, substance abuse comes very strongly with bipolar disorder. So it affects many different areas. So this is why you really want to be with a therapist to help manage those things also. When you're talking about hoarding disorder, even though there is some people who have hoarding disorder and obsessive compulsive disorder, and it used to believe those two things were very linked, research has shown that's not true. It's a low percentage of people who actually have OCD along with hoarding disorder. So unless you have another mental health disorder, there really isn't medication for hoarding disorder specifically. So it's really about, that is truly about cognitive behavioral therapy and working on behavioral changes and thinking and thought process about collecting. Also, there has been some research on scans of brains with neurobiology with people who have hoarding disorder, and their areas of the brain that use for processing and organizing aren't as functioning or as well developed as other brains of people who don't have hoarding disorder. And they seem to also be somewhat more detail oriented, meaning they might look at something that's a cup, for instance, and see a beautiful design where I might just go, well, it's just a logo. So they see things a little differently. So the only way really to deal with hoarding disorder is through therapy. Now, the problem with hoarding disorder in particular is people are so ashamed of this behavior that they won't seek out treatment, or they might be in therapy, but they don't tell their therapist this question. And unfortunately, a lot of therapists don't know to ask this question. So I specialize in hoarding disorder. It's something that I work with a lot of people on. And I know to make sure that anyone walking through the door, that's the question I ask them about acquiring and discarding and what's their environment look like, because that can be a good indicator if someone might have hoarding disorder. So these are the two other prevalent disorders in our country, and I continue to work with people on both of these disorders also. So again, I'm going to continue to say to people, you do not need to suffer. There are people out there who are here to help, who can help treat you, and you just need to pick up the phone. So if you come to a healing place or you go to another place, please find someone to work with, because you can have a normal life with both these disorders. There's this myth out there that if you have a mental health disorder, you can't have a normal life. That is absolutely not true. There are many people people who have mental health disorders and who are functioning fine in the world, because they are doing the medication, they are doing the behavioral health, they are doing the things they need to do to keep themselves healthy. So please